So moving beyond the basic scientific facts, one has to recognize that the findings from these studies are not they're not disseminated into some ideal value-free arena. Rather, there's a social context with a variety of competing interests, agendas, theories, and not least capacities for critically evaluating the evidence. And there's a tremendous, as the evening news and the second slide referred to, there's a tremendous appetite and a tremendous interest in things that could potentially harm us or things that could potentially benefit us. And both of these things can be easily, with just a little bit of tweaking, can be underscored and can be made to seem more important than maybe they are. Next. Now, the effects of inflating hazards aren't trivial. One is that this can induce confusion about what is truly a risk. People have the understandable reaction, well, everything is bad for me, so why should I quit smoking? I'm surrounded by this and that horrible thing. I'm gonna get some dread disease. And ironically, there are studies, recent studies showing that fatalism about health may be a risk factor. Why? Because if you feel fatalistic about things, you're less apt to go for colonoscopy screening and so on. So people focus on the wrong things, and very serious is the fact that you can have, when these things get played up and there's concern, you can get agencies of the federal government and international agencies advocating policies which look as if they actually cause considerable harm. And the best example, not the only one, but the best example is that the single-minded focus on a high-fat diet starting in the early 90s, maybe late 80s, as a cause of breast cancer, which came into prominence at that time, led the food industry to put out a lot of low-fat items on the supermarket shelves, Snackwells and so on, low-fat yogurts, low-fat everything you could think of. And since if you remove one macronutrient from a product, namely fat, you've got to substitute something else for that. And what was substituted was sugars and simple refined carbohydrates. And there is very good evidence that, quite persuasive evidence that this focus on low-fat diet led to increased consumption of calories, which led to the increase in obesity of the past 15 years or so. Finally, epidemiology has gotten a bad name because of all these conflicting results that are put out there. And epidemiologists and people at Harvard have commented on this 10 years ago, saying people don't trust. Eminent epidemiologists have said people don't trust us anymore, and sometimes we do more harm than good. So, next. So what I focus on is what I call the sociology of health hazards in daily life, and we can go to the next slide. There's a multiplicity of players who are involved in this, and let's go to the next. And what some of the dominant themes are that because this is a complex picture that we're talking about, and because diseases have multiple risk factors, and certain things can get emphasized, other things can get little attention, and often, as I mentioned before, there can be a failure to put important facts in perspective. Next. And it takes time for really important findings to get established. Many things get studied. It's only a minority that turn out to really be important. That's to be expected. And so there's a lot of false starts. There's a lot of things that need to be looked into. But it took 15 years between the first studies indicting cigarette smoking as a major cause of lung cancer and the publication of the first government report in the United States, the first Surgeon General's report on smoking and health. And this is true for other important discoveries. Next. There's a big gap in understanding between specialists and the lay public. The words that are used are understood differently. The concepts are different, and this sort of makes it very easy. As I said before, sometimes one can sort of tweak a result and imply that it's more important than it actually is. Well, this gap in the understanding of these things sort of makes this kind of misunderstanding easier. Next. So, sort of said this, but the magnitude of the exposure and the number of people who are exposed to something it's often implied that things are more important than they are, or that they affect more people than they actually do. Next. There's a big gap in the perception of risks. What scientists tend to think are the important risks, the public tends to not worry about, and vice versa. And there are examples of this. Furthermore, there is a human tendency, if someone you know develops a dread disease, there is a tendency to want to come up with an explanation for why that person developed the disease. It seems to be instinctive on our part, and it's a lot harder to focus on things that we know affect health, which are under our control. It's very hard to give up smoking, although many people have done it. It's hard to lose weight, and so on. Finally, it's often not allowed for that there are just things that we may understand a little bit, or we may understand something about causes on a molecular level, but we just haven't identified the culprits that we're looking for some of these common diseases.